How we doing, everybody? How are you? Let me get set up here. I think you should be able to see me. I'm waiting to see it on my phone right now. If it pops up, it's delayed. But I've had a lot of people ask us in the office. We've had a lot of families and friends and people, we just know that this year allergies have been out of control and probably more so than any other year. They don't understand why. And I even had some allergies this year, and I never have allergies. So wanted to go through this real quick with you guys. I spent about 20 minutes on this. Any questions, let me know. I can't see it, and I don't have two monitors, and I think I need two monitors to see it. So please let me know. You can ask the questions, and I'll get to them as I go through this. So we'll spend about 20, maybe 30 minutes on this. Lots of great information. So if you have pen and paper, get ready, write it down. Probably learn a bunch of things you've never learned before, especially if you're an allergy sufferer. This is an angle at this that's probably never been discussed. We'll go through some of the common things. We're going to go through some of the newer things that are going on and how you can solve it for yourself. So, yeah, waiting to see it on my phone right now. If it pops up, it's delayed like this. That's probably never. Let me load this. So here we go. All right, let's get into this thing. All right. So in 2021, the signs point to the fact that allergy sufferers may be in for the worst allergy season than last year, which has been exactly what's happened. Many cities have said at least 20 days earlier than previous years. We've seen blooming. We've seen the flowers this year have come up like I've never seen them before. So I don't know how that's working, but it's definitely been a unique year as far as what's going on in allergies, right? But let's first define what an allergy is, right? I mean, I think that's super important because there's different realms inside of allergies that we're going to be discussing, right? So it's a hypersensitivity, abnormal immune response to a specific environmental substance or conditions like pollen or those kind of things. We're going to go through some of those. The physiological response is the body mistakes the substance as a harmful process, like it doesn't understand what it is, makes the antibody, which is the Pac-Man. We've heard about antibodies all over the news with COVID, obviously. So the body's natural defense system is going to try to fight it, right? So things like food, protein, dust, pollen, chemicals, right? Conditions like heat can make it worse. But here's like the big ones, right? So you have mold, bacteria, dust, smoke, viruses. Yes, viruses, even bacteria, environmental pollutants. These are just some of the big ones. There's more. And food. Yes, food. So I'm going to talk about how these are segregated, how they overlap, and then how it's pulled on this side even too. So we're going to kind of go into three different realms of this, which is probably never been talked about in the realm, at least to you, in the sense of what an allergy is, right? So common allergy symptoms, right? Obviously, people know this that have them: sneezing, irritated nose and throat, nasal congestion, headaches, itchy, bloodshot, runny eyes, like just like you scratch your eyes out, dark circles under your eyes, trouble breathing, brain fog, and runny nose, to name a few. Those are big allergies. But what is a food sensitivity? And I'm going to tie this together, so don't stay with me here, right? What is a food sensitivity? It is a diffuse and poorly understood reaction to food that may be associated with increased levels of certain IgG classes. IgG means it's a type of Pac-Man, right? So it's a certain type of antigen that are reactive to the food. So when you eat the food, the Pac-Mans come out. Unlike a true food allergy, which we'll talk about, the symptoms can be delayed for days or after ingesting the trigger food. So when people have sensitivities, it could go from a day to some reports and some studies show up to 20 days in order to have that delayed reaction. So you could be eating something as good as spinach and saying, look, I'm healthy, but your body reactively doesn't like it. And it may take 1, 2, 3, 5, 10 days, 20 days to have a reaction to that. People who have food sensitivities can go a lifetime without ever knowing that they have one due to delayed reaction times and vague symptoms that mirror common ailments. Some signs may point to food sensitivity, including bloating, migraines, and diarrhea, just some common ones, right? So here's some of the big ones that we have. We know that common food allergies, right? So when you have an actual allergy, so a sensitivity is something that's delayed, and allergy is actually like now, right? So you have it immediately, right? So these are things like skin itches, flushes, hives, right? People have, drinking something and they get hives, or they eat a peanut and their throat swells up. gastrointestinal stuff like vomiting, nausea, abdominal pain cramps, diarrhea, respiratory, right? Wheezing, throat, swelling, clothes. I said that, asthma, circulatory, dizziness, faintness, heart irregularities, sense of impending doom, which everybody feels like that right now. And so it's interesting. I'll have a lot of people with vertigo. And what's funny, we adjust them, we check them out, we change their diet, correct their gut, and the vertigo goes away. It's crazy how that works, right? Anaphylaxis is constricted airways in the lung where you're like, you can't breathe, almost like an asthma response, right? That's where that comes from. Food intolerances, which is another distinction, right? So you have allergies, then you have sensitivities, and you have intolerances, 3 different things, okay? You have allergies, reaction quick, sensitivities delayed, and then intolerances is like your body typically just doesn't understand it, does not have the enzyme, it cannot break it down, it doesn't know what to do with it, so now it is like stuck with it. So if you know anybody that's lactose intolerant, if they eat dairy, they're going to the bathroom in a few minutes, right? Same thing with beans, some carbohydrates. Yes, people have sensitivity to carbohydrates. We're going to go over some diets later on. I'll talk about that with you, right? So some pretty amazing stuff. Gluten, celiac disease. Well, that's a true intolerance. Like people can't even go near gluten versus sensitivity where it bothers them, right? And then cruciferous fruits and vegetables, it's enzymes in there, go in there. So here is how the reaction happens, okay? And sometimes people are like, I just want to give you a little bit of the why. And I've made this very simple. I found this is really simplified the way it works. So you have an allergen, it comes into the body. The plasma cell looks at it and says, hey, what's going on here? The IgE, always remember immediate. That's how I remember. Like if you have like a peanut, immediately your throat will swell up, right? And then the mast cells, like the fighting cell, it's going to be like, hey man, get out of here. And then an allergen re-exposure, it's going to be more mast cells, so more reaction. But when that happens, it releases something called histamines and cytokines, okay? And those are inflammatory, and that's what gives you the stuffiness and the congestion, the achiness, that kind of stuff, which is the symptoms. So that's kind of the mechanism. It's very watered down, but that is it for an allergy. But how does this react to different reactions, right? So let's show you that, right? So I just showed you the food allergy, which is the first one, right? IgE, immediate, right? So you have that histamine response, you have that tissue, the basophils, those little fighters in your body are floating around trying to fight stuff, right? It's rapidly onset, it's quick, fast, you have hives, trouble breathing, something like that goes on. Excuse me. Food sensitivities is a non-IgE mediated, excuse me, non-IgE mediated. And so what happens there is that now you have different type of Pac-Mans coming out, and they're going to have reactions to it. This reaction is more white blood cell driven, different type of fighters, could be delayed for up to a day to 2 days to 3 days to sometimes, like I said, even some studies have shown 20 days. Then you shift over to food intolerances, which is I was talking about, lack of enzymes or pharmaceutical effects, and you can see how that goes through there, right? How it goes down that. So those are the differences in how you actually see it. I just wanted you to get a good visual of that. So medications, right? I know a lot of people take medications for allergies, and there are so many things you can do to avoid that because one, medications make you sluggish, make you tired. So things like antihistamines, over-the-counter prescriptions, right? These bind to the receptors. These medications treat allergic, like sneezing, itching, runny nose, but they cause drowsiness and dry mouth. That's the number one complaint I get with these. Like they're like, I just feel like someone sucked the water out of me. Decongestions, right? When you're experiencing like a lot of congestion, these effects are only temporary and usually worsen if you continue to take the drug over time and can even affect your blood pressure. Steroid sprays, right? Nasal sprays combat swelling in the nose. So if it's really swollen here, opens that way up. But you know what happens? Often these are very addictive and people get stuck on them, right? And cromolyn sodium is over-the-counter nasal spray. It's a cascade of allergy symptoms. Start to use 2 to 4 weeks. But again, these are just really hard on your nasal pathways, and then eye drops, right? So these are typical things people grab. They grab them all the time. They'll use them, and they keep repeating use them, and it'll help that histamine response. But it's also the side effect that we're working with, and also the cause. Like, why are you actually having that reaction? and looking at this, and I'm driving down this food-mediated response because I truly believe a large percentage of people with allergy problems is derivative from your gut, which is coming from our environment, which is coming from mainly our food. So here's again another comparison, right? Food sensitivities, any age, 45% of the population suffer from a food sensitivity. 45%. Okay. This can come on gradually. Again, one from short term to up to 72 hours, again, as long as 20 hours. It's not life threatening, but it will change eczema, mood, headache, weight gain. These are all kinds of things: tiredness, fatigue, bloating, inconsistent stool, constipation. I had a patient come in today. She's like, I have had chronic sinus infections for years. We put her on our program. She's like, it's the first time I have not been sick every single week. And she's just blown away by it because she's like, I can't believe that this is actually all these years, all these drugs, and I'm actually finding what's wrong with me, right? Common causes: wheat, gluten, dairy, corn, eggs, sugar, sesame, soy, right? And then environmental triggers. So those are some big ones, right? And this is self-assessment of how you're feeling. And then the food allergy is the opposite, right? Development from infancy, right? I got some great stats in a second on this. 2% of adults, 6 to 8% of children have allergies, right? Life-threatening can be, right? Hives, itchy fever, swelling can constrict your airway. Immediately, that happens pretty quickly, 0 to 2 hours. And then common causes, again, are peanuts, tree nuts, eggs, milk, fish, shellfish, food proteins, medications, and stinging insects, right? How many do you have typically? 1 to 2. Compared to food sensitivities, can be multiple sensitivities. I just ran this on my mom, and she had a plethora of sensitivities, which was pretty amazing to see all these different ones. But this is super interesting, guys. This is where like it gets super cool here, right? So cross-reactivity, right? This describes an allergic reaction in which the body responds to one protein, so whatever is coming in, that is similar to structure to another protein. So you have one protein, yet it looks kind of close to this one. What is the body doing, right? Such an immune system will see both substances as the same. In this case of food allergies, examples of cross-reactive include, watch this, ready? This is pretty cool. Cow's milk and milk from other mammals. Cow's milk and soy. Peanuts and tree nuts. Peanuts, legumes, and soy. Cow's milk and beef. Eggs to chicken. Yes. Is that crazy? So people are like, yeah, I know eggs bother me, but chicken's good. But you don't realize the reaction that's happening. It's pretty interesting how that is, right? That's a good one to take down. That's a great one. But I got more. This is even better. Latex food syndrome. Yes, this is actually something in which an allergen to latex can cause an allergic response to foods like, ready? Avocado, banana, kiwi, chestnut. I think that's so fascinating that these foods have types of latex in them. So you actually have this latex reaction syndrome, right? And then there's this oral allergy syndrome, or OAS, in which they present a true allergy, which is basically, like I said, I mentioned it earlier, where you literally goes in and the body has no defense around it. It can cause allergy symptoms when cross-reactive foods are eaten. So watch this, right? The true allergy usually involves tree gas pollens, which your body doesn't like, or mold spurs. But watch this. So alder pollen, which is a type of tree, and apples, cherries, peaches, pears, parsley, celery, almonds, and hazelnuts are similar to alder pollen or alder pollen. Birch, right, which is the birch tree, plums, peaches, nectarines, apricots, cherries, tomatoes, peas, cilantro, almonds, and beans. Grass pollen, melon, watermelon, oranges, tomatoes, potatoes, and peanuts, which is pretty interesting if you think about this one, right? Grass is coming out. You're excited. Summer, spring's coming, right? What do? You want to break out the melons, the oranges, tomatoes, make salads, potato salads. Like it's everything we eat in the springtime. And look, it's cross-contaminated. It is literally something that as you smell it and the food you eat, it's the same exact reaction. It's causing an inflammatory immune response. Mugwort pollen, celery, again, it's a type of plant, celery, carrots, dill, parsley, fennel, coriander, cumin, and sunflower seeds. Ragweed pollen, watermelon, again, cantaloupe, honeydew, bananas, zucchini, cucumbers, and squash. Find that absolutely fascinating. It blows my mind, right? But watch this. In the U.S., hospital visits for food allergies increased threefold, people, Threefold since 1993 to 2006. Why? Okay. Between 2013 and 19, England saw, ready? 72% rise in number of hospital administrations for children caused by anaphylaxis from 1,015 to 1,746. That's a staggering number increased, right? Why? What is going on? Is it our food? Is it our environment? Is it the way we're being delivered? I'm going to go over that in a second. What is going on? Why are these things changing? We're seeing it around the world. I could have went through stats here all day, but it's statistically showing we are having a bigger problem with allergies and food allergies and sensitivities, right? The rate in which food allergies worldwide has increased from around 3% in population in 1960 to about 7% 2018. It's a pretty big jump. It's 2.5-fold. Right, here we go. This is a great one. This is one of those reasons there should be a link between food allergy and babies born by cesarean section. Yes, I said that. Not emerging through the birth canal means the baby does not get enough useful bacteria. As the baby's coming through, it's grabbing some bacteria from mom. It's creating a certain microbiome in the gut, right? In Denmark, it was even proved that the more cats and dogs you have, the less likely you are to have allergic disorder. We did a question in the office this week about allergies, and that was one of the questions. Yes, when you have more pets around you, it's like this, guys. You got to get this. The junkyard dog doesn't get sick. The dog that's outside smelling pollen, eating license plates, and doing anything else doesn't get sick. Why? Because as a puppy, it was out there and getting all these environmental things. We are not getting it. We're just not around it. We're too clean. We're too isolated. And we're not getting the birthing process the right due diligence. And when this stuff happens, we are set up for failure. We're also not giving our kids the food early on. Right, here we go. There is a window of opportunity in the early years to establish tolerance, says Alexandra Santos, an associate professor in pediatric allergies at King's College in London. She helped demonstrate through a learning early about peanut allergy study that introducing peanuts, which is such a huge problem today, right? Which was never a problem when I was a kid. Why now, right? Between 4 and 11 months gave a 5-year-old 80% lower. When you give a 4-month-old to 11-month-old, give them the actual peanut, okay, they have an 80% lower chance of gathering that allergy. Okay, let's go through 6 things. 6 things. This is a common thing inside the world of functional medicine. They call it the 6 steps or the 6 R's, or there's some different names for it. But it's a great outline. I like to use it. It makes sense for people to get this, right? So here's the first 3, right? So here it is. Effective palliation is essential for an allergy patient. Yes, medications and supplements can help here. Even essential here, depending if you're having an anaphylactic reaction, you better take something to take that down, right? You better get that reaction down, especially in the early course of treatment. So reduce symptoms, right? You got to get your symptoms down. But how do we do that, right? Well, we got to remove the antalgic load. Don't fall in the trap of thinking seasoned allergy sufferers only have to deal with pollen at hand. So people, here's what's interesting. You got to get this. We know in our chiropractic office that the spring is going to bring more neck pain, more back pain, more shoulder pains, more elements come into our people from pollen or wherever else is coming from. And what happens is it raises their inflammatory response. Their body gets irritated. And now the joints are at a heightened rate. They go to do something and pull or mow the lawn, and boom, they have a problem. It is predictable, people. Like literally, we see it increase every spring, every time. Okay, so cast a wide net in your investigation of allergies and sensitivities. It is a combination problem. Most of the time, it's a combination because, and if it's genetically driven, which there are allergies that are genetically driven, it is not. You're not helping it with the environmental sensitivities. Remove also includes the investigation and treatment of toxic exposures, including in our diet. Clean organic foods are important for allergy patients. People don't realize that when you're eating GMO, genetically modified organisms of food, which are not, to me, real food, it's modified, then what happens is, and you have an allergy or sensitivity, you're raising that bar higher to cause a bigger reaction because the body has to look at it differently than a regular food. It's just the way it is. Number 3, repair barriers. Very, very important step here. This is where most people get kind of lost. Allergic sensation requires hypermobility barriers, which is going to be around your gut, your skin, your lungs, your nasal mucosa, and often possible sites of sensations if damaged. I'll give you a hint. Here we go. Ready? If people have sinus issues, right? If chronic sinus issues all year long and skin issues, it's their gut. And then it's usually a sensitivity or an allergen to something else and or both. So that's just give you a little detail there. Nothing ushers in a barrier permeability like high histamine. That's the response, right? So as you get this allergen in and your body's creating this histamine response, that's that IgE response. It's going to come in quick. What happens is it opens the floodgates up for these permeabilities, which means that things like your lungs, your gut, your skin lets things in and out faster, which you don't want. That causes more havoc. Okay. In allergy season, because of increased permeability, you are likely to identify other antigens that are not an issue at other times of the year. Like I was saying, you get like neck pain and back pain. That's just an example of an off spin. But you could be things like, hey, normally I'm okay with eating peanuts, but now in the spring, I can't eat peanuts. Okay. This is especially true of foods. A good barrier repair protocol is an essential piece of a successful allergy program. Number 4, restore the microbiome. Get the gut right. Dysbiosis, or the gut not working properly, is part of a pathogenesis of allergic disease. It needs to be addressed and corrected in everyone, period. This can be as simple as altering diet, okay, to completing a full functional stool test, looking at what's inside that gut of yours and addressing the identified imbalances. Probiotics, fermented food, prebiotics are all important things, but may not be all the answers for people. I know a lot of people are like, oh, I take a probiotic every day and I still have issues. Probiotics are great when they're used right. I think people are using them wrong most of the time, and then they're not using the right product most of the time. Number 5, replace includes correct nutritional insufficiencies with goals around reducing inflammation and building tolerance, right? So think about vitamin D. Number 1 problem with people right now is that I would say 95% of people that walk in our door that we run labs on, they are highly deficient in vitamin D. And we know vitamin D is our immune activator. It is a big barrier for what we do in our immune systems. And without it, we just don't function. Vitamin A, omega-3s, which is the good fats, and some sublingual immunotherapy. Digestion must be impeccable in an allergy sufferer as larger protein fragments can become antigenic. What they mean by that is as these bigger particles come in, these particles, your body can't understand them and break them down. And if they're going through the gut into the bloodstream, that causes something called autoimmune. It creates this antibody response, which triggers it out into an autoimmune response. If you have someone that's autoimmune driven, most of the time there is a gut component. And there's somewhere coming through that. There could be toxic, there could be stress things, there could be viral loads, but there is usually an underlying GI issue. And that GI issue is a portal into the way of the body, and the body can't handle the overwhelming response. So it gets confused and starts attacking something else in the body, like your skin, your GI, your organs, whatever it is, it goes after it. It's the roulette wheel of being sick. And number 6, the last one, rebalance. Plenty of research demonstrates that the heightened stress response, yes, when you're stressed out, will promote allergic disease, period. Indeed, adrenaline, the fight or flight, right, itself is a mast cell antagonist, which means it's the one that creates the inflammatory response. High cortisol, which is your fight or flight, is a barrier damaging molecule. I'm going to say it again. High cortisol is a barrier damaging molecule, right? So just like steroids are, right? So it is something that goes in it. It'll calm it down in that sense, but it creates damage to the cell where it can't be repaired. Part of the allergic sufferer's journey, if they are to be successful moving to the other side, they must include embracing some of these mind-body self-care regimens. Okay, a couple more slides, guys. We're done. Food allergy tests. Okay, so this is what most people understand, right? This is where I went to the doctor and they said I had allergies to mold and trees and whatever else. And then they ran some blood on me. We looked at some CBC, TFT, which is important, GRBS, urine, right? We looked at some of these tests and they all measure IgE, immediate, right? So if you eat a peanut, it could tell you that you're going to have a peanut. So they scratch you like these here. They do that scratch test with the apple or whatever they do all over your back, and you get the hives. That means you have a high IgE response. But guys, why? Right? What's creating that hyper response? Why are you going from a 0 to a 10 instead of going from a 0 to a 2? That's because there's already a fire going on inside your immune system. So anything that happens, it just takes it to the next level really quick. So this is the standard test, which is good to know because you don't want to eat these things or be around these things the best you can, because you need to know that because it's going to just create more inflammatory response. It's one of the studies said earlier, the more you're around it, the more it's going to create it. So it's important to get away from it, but you got to get this. You got to also understand why. So this is a stool test to the left that we do. We look at your poop for 3 days. We want to know what's going on inside that poop. Who are the families of bacteria? Are there pathogens? Is there yeast? It's a whole comprehensive test. Excellent, excellent stuff. Then on the other side is something called IgG, which is the food sensitivity test. And it's a snapshot of looking at foods from that delayed response, right? We look at multiple foods, 190 foods, and we say, hey, if these things delayed, are they causing a reaction? So then you have IgE response, immediate. Then you have delayed response. How's that doing? And then you also have, hey, what's going on in this ecosystem, which is my main immune system, right? Remember, 86% of your immune system lives where? In your gut, right? Where do all your neurotransmitters live? Your happy, sad people in your gut. They're made by your gut. Where do you convert a lot of your thyroid? In the bacteria of the gut. Where do most people have a hard time losing weight is because the bacteria in their gut screwed up. When I tell you your gut bacteria is everything, it's everything. And it's especially when it comes down to people with allergies. So guys, I hope you enjoyed that. It was quick, but to the point. I wanted you guys to understand some relative understanding of what it is to have a food allergy or an allergy outside. What is it to have a sensitivity? And what is to have an intolerance? And how does that affect your allergies on the other side? It's clearly how this works, okay? So if you guys are interested and you want to do something and you feel like, hey, I want to get some labs done or I want to have a consult, this is how you can reach us right here. It's called the office at 678-482-4400 or functionalquestions@gmail.com, and we'll get you set up for that. Hope you guys enjoyed that. If you liked it, please do me a favor and think someone else can love this or get some information on this. Do me a favor, share it with them. Just hit the share button below. Let it go out to other people. So many people are lost inside this allergy thing and they don't know what to do. Just keep taking all these medications which aren't solving their problem. This is a great way to actually solve what's going on with them. Hope you guys enjoyed that. Have a great one. Be good, guys. We'll talk to you guys soon.